Hello everyone and welcome back. Got a fun one for you today. This nice young gal decided that she and her scooter were not going to be friends and she went right over the handlebars on that thing. Scooters are probably my number one thing. I do see those canines hanging up there. We got her scheduled with my oral surgeon to get those pulled down. But here's what everything looked like. You'll notice the instant almost discoloration of this tooth. It had been about a month since the accident when she came in here. And I've noticed this on kids before where you almost have like a hyperemic response inside the tooth and that stains the tooth that red color. So we're going to be taking care of just number 8 as far as from the root canal and the bleaching standpoint. And then when we finish everything up, I will do both teeth at the same time as the mom requested. As far as the access, you'll notice it's a little bit different than I would normally do here. I almost did more of a large oval. The reason why is it's already a big canal. I mean, it's not like I'm really going to be destroying that much tooth structure by making it slightly wider, but it makes it far easier to get the bleach inside there, the sodium perborate. And when I'm using that F5, you'll notice I'm doing a brushing motion to try to pick up everything. There's that pulp tissue. I see this a lot in kids as well. She didn't have a true avulsion. It was a lateral luxation where the tooth was pushed back lingually. Thankfully, they got into the dentist, put it back into the right spot. I'm not sure why it took them so long to find me, but I'm still happy we were able to get her taken care of. Her tooth should be totally fine. As far as how we do working length here, this one was pretty wide open. I was able to get some stability with the 10. Oftentimes, I'll have to use a larger like headstrum to get the length here because it's so, it's pretty much a hot dog in a hallway. There's nothing much for it to grab onto there. And you'll notice this is where those locking forceps really come in handy. So 22 is the working length here. Going to make sure the F5 set up to that amount as well. Looking good there. And once again, that brushing motion is really key just to help kind of scrape the walls. Normally, I'm not really too worried about that, but in a case like this, the reason I'm scraping the walls is you'll notice, I'm going to show you here in a minute, it's actually already starting to lighten the tooth just by me getting inside there and kind of scrubbing that area. With all trauma cases, I use calcium hydroxide. My worry of resorption is just too high. And what we're going to do is while she's in calcium hydroxide, I'm going to start the bleaching process. So you can see here, I'm taking some Cavit and putting it down on top of where that calcium hydroxide is. Cavit does expand slightly, so thankfully I'm not really worried about having any leakage of the sodium perborate into that area. I've also seen some studies showing you can put the sodium perborate on top of calcium hydroxide and it will inactivate any of the stuff going down into the root structure. I still feel more comfortable having a barrier on top of here, especially for the changes, because when you change the bleach, you're going to rinse out the calcium hydroxide. So anyway, this is kind of how I did it. I start the process with a glick and then finish up here with my normal plugger. You can see I'm using the thicker back end of it just because it is pretty far down there. You want to make sure that your barrier is apical to the CEJ because she's going to have some continued growth here. And if we don't bleach a little bit apically to that, by the time she's, 20, 21 and has that late growth spurt, you could almost have a red stripe there, which is, fun beer, but not really what you want to have on your front tooth. So using the sodium perborate, I'll drop a link to where I kind of explain more in detail, professor style, how this whole thing works. But pretty much that's the combination of the two different pellets and powder that I use. I really like that combination because I think it gives some initial really fast bleaching and then the pellets kind of make it last a little bit longer. It's also easier to place when it's in this almost paste form like this. So that's just kind of a trick if you want to talk about that. And then just Cavit on top. That's pretty much how it works as far as the temporary. When you're doing these temps, it's always a gamble between how full do you make it, because you do have to get bleach all the way to the coronal aspect of the tooth, and how deep do you make the cavit. So you're not going to get your traditional 4 millimeters of cavit here. You got to kind of play around with this. Thankfully, we schedule these patients back in a week and get those taken care of. So you're going to see the x-ray here. That's what the calcium hydroxide looked like. As you can see, those canines coming right on in there. But this is what the tooth looked like initially. And as I was telling you, you can actually almost see a little bit of whitening already. Some of that is because the tooth did dehydrate from the rubber dam. But here we are 1 week later. I forgot to do the video of the bleach change there, but we changed the bleach, called the mom, and they were both very happy with the color. So we didn't see him. So this was just 2 total changes of the bleach, the initial and then 1 week later. And they were very happy with it. So bring him back here, take out that initial cavit, and then using the workhorse. Ooh, I said it right that time. Take down that barrier as well. And you want to make sure you get rid of all of the cavit here because I don't think it's going to lead to any staining, but it certainly isn't going to be as good as having composite inside there. The other thing to always mention to your patients here, they will often complain of almost an opacity when they're in the temporary, and that is because Cavit is very opaque. So it almost has a stripe running through it. Instead of a red stripe, this time it's an opaque stripe. That's not a beer that I've ever had. Maybe that'd be a fun beer, actually. Anyway, and you want to make sure you remove all of this, but you will let them know that, when we do the final, we're going to put something a little more tooth-colored inside there. So you did see I did recapitulate with the 20K file, but it's wide open, so not even sure why I did that. I think probably just, habit and history. So going through the process now just to make sure we get all of the calcium hydroxide cleaned out. I sped most of this up because you guys have seen this before, but you just want to make sure that everything is nice and dry and clean when it comes to fill this up. Now, as far as how we're going to fill this up, with it being this wide, I'm not doing the squirt fill on this one. I'm going to use a regular cone here. Thankfully, the SS White ones work really well. They match their files really nicely. Not sponsored, just a fan of it. As you can see, it drops straight to 22, which is where we were. Little bit of AH plus on the end just to make sure everything looks beautiful. And then you'll notice here I'm using a larger tip. That's because the apical size of this is a 5008, and the 4004 or 4504 that I usually use would actually go out the end of the tooth. So I like using a slightly thicker one. So that was a 5506, I think.
I'm Ron Burgundy?
Yeah, and makes a big difference there to kind of sear it off. I have a bunch of different tips for different sizes, but in general, I'm going to be using the 4504 for the vast majority of cases, and on a larger one like this, I'll up it to an 06 taper. So measuring, making sure everything looks great. As you can see, you got to purchase nice and flat. The larger axis here did make this a lot easier too. So, normally I like to keep things nice and small. Quick measurement there just to make sure we know what the post length is going to be. Clean off any remaining AH+, and you can see I used a very, very large post there, and even that was a hot dog in a hallway. We're going to use that analogy a few times today. And with it being that large, you want to use a larger post, pretty much the largest one that can fit. What I'm doing now is just roughening up that surface to expose some more enamel rods, make sure there's not any unsupported enamel, and I'm doing really light strokes here, but you can see how much tooth structure is actually falling away. It's because the enamel was so thin. If you try to bond to really thin enamel like that unsupported enamel or those sharp angles, it's going to break and it's going to be very obvious.
You're gonna have a bad time.
Speaking of obvious, one thing I'm going to do here is dimple this area. So shout out to every restorative professor at UOP for teaching me this one. But you almost want to do a stair-step approach here. If I were to just fill in that flat line, there's a very obvious demarcation between where the composite ends and where the tooth begins. By taking this diamond and just doing these little dimples here, you'll especially be able to see this when I do the disclosing, it's going to create some randomness so that when your eyes look at it, it's not going to be super obvious where the composite is. And you can almost see, it looks like almost mamelons almost, or like developmental grooves. And that's what you want it to look like. So when the composite fills that area in, it's going to blend in very nicely with the rest of it. And you'll see here that we are blasting everything just to make sure we get as good of a seal as possible. One of the reasons composites fails over time, and you can start to see that margin between them, is because you didn't remove the biofilm. If you leave that biofilm in there, it doesn't matter how much you etch it, this stuff isn't going away, and you can start to have staining over time. So this is one of the things I like to do with all of my anterior, I do it with all of them, but with anterior composites in particular, this is a really nice trick to make sure that this is going to last a really long time for her. She's only 13, I want to say. So I usually like to have my female patients wait until at least the end of high school to get any permanent crowns or anything like that, and ideally college. For the young guys, at least the end of college, if not 25. Just because we've seen more and more evidence, mostly from the implant literature, that there's that late growth spurt, and if you get those veneers or crowns done too early, what's going to happen is they're going to have them redone at 35. I'm 36, and a lot of my friends who had trauma and had crowns done at that time are starting to see a little bit of root structure showing on there. So the longer you can wait, the better. And the way that you can make the patient okay with waiting is you make really, really pretty restorative, composites that look as good as the natural tooth structure. And I think this is what we did here. So shout out to David Clark again. That's what everything looks like when it's all been etched, cleaned off, ready to fill. And that's what the inside looked like with the gutta percha. Really nice fit actually with that big 110. So what we're doing here, this is the room that has the two-step update. The whole team loves the one bottle. The one bottle's worked out great for every restorative things that we've done, so I think we are going to switch to the universal system. That it's just a great product. So this room, though, had the 2-bottle system. I did buy a full one of each just to try it out, so we're going to use this up and then eventually switch just to the single. One thing to do here is make sure you have an air only, so there's no chance of water being inside there. You can either use, there's a couple different ways to do it. I have a little Stropco attachment on my ASI cart, works really great. And that just makes sure that when you're air thinning, you don't shoot any water out. Going in here with the bond, and you'll see same exact thing, just air thin. Make sure you have that really nice thin layer because that is going to really help improve your bonding. Make sure you're scrubbing in there as well. Follow the instructions for use. Don't just dab it on and call it a day. But that air thing is really, really important. You don't want pooled composite in a case like this. Now, technically, this is kind of a BioClear setup. I'm not using their matrices here because she's got that giant diastema, but I did use the composite warmer. But before we do that, we have to cement that post. And by cement, I mean bond. So using Luxacor here, I like to use the shade A3 because it gives you that Dentin shade. So what comes through the tooth is more what would be there naturally. You'll also notice that I'm trying to have most of the composite go onto the palatal surface. I don't really want any of it going onto the buccal because I'd have to cut it back. Well, I was thankful in this case, I was actually able to make it all go on there and really not have to do too much cleanup because I didn't want to have to go back through the process of etch, prime, bond and do all that stuff here. So you can see I'm just shaping it so that it would be pretty much where the Dentin would end anyway. Think of this as a kind of like Dentin replacement option here. So Biomimetic, you can see the color there, definitely a little bit darker, but because it is that darker, almost natural Dentin color, you'll see in the final looks really good. So I'm doing a combination of heated flowable composite along with heated packable composite. I love the 3M product. Once again, not sponsored. They just make a really, really, really nice composite, and it holds up very well to the heating. Their studies have been shown you can, I think it's like 30 times you can heat and cool it, and there's no degradation in properties, and I certainly don't do it that much. So what we're doing here, building everything up. I'm going to freehand both of these because they're wide open. I can access everything. I don't need to worry about it. So kind of just getting the shape that I want here. This is a little bit more risky when you're doing this part here because the composite doesn't have anything to like push against. So the shaping here, I try to minimize it as much as possible, but I am just going to make sure we get the bulk of the composite out of there so I don't have to remove as much and make sure that my shapes look good. I'm also going to make sure that I have enough height. So I'll almost make these teeth too long so it gives me more to work with. So ended up doing 40 seconds of light here on this. Just make sure everything is really, really well set up. And we're going to start the process here of removing the composite. So I like to do this initial part with the rubber dam on. All I'm doing is cutting back the composite until I can see where the tooth structure is. So you can see how I'm just doing these really, really light brushing strokes. The reason we're doing this is so that we don't have to have a bunch of dust inside the patient's mouth. The suction can take up most of it. And I like to do this dry as well because you can very easily see composite cuts differently than natural tooth structure does. And it also creates dust in a different way. So you can see how on the coronal aspect there, I'm still working on the composite, but right where that dust is pooling, that's where the natural tooth structure is. So I'm slowly working this back, and once we get things close, we'll take the rubber dam off to do the final polish. I also like to do the final shaping with rubber dam off because I need to see the patient's eyes. That's how I kind of judge midline, how I judge incisal edge. I'm actually really excited by the time this video comes out. When is this one coming out? I'm not sure when I'm posting this video, but I am going to the Spear campus in December for their facially generated treatment planning. I've used their stuff for a very, very long time in planning all this. It's a fantastic option. So polishing everything off here, just making sure we get that shape as pretty as possible and kind of going through that process here. So you'll notice I'm not really touching too much on the diastema here. I want to just get that buccal surface to where I want it to be. And I'll do some more fine tuning of the line angles once the rubber dam is off. Now you can see the roughness there, and it thankfully fits kind of that prepper just perfectly. But I'll do a slight bit of polish here while I have the rubber dam on, just because, once again, the more you can do with the rubber dam on, the less mess there is inside the mouth. And I do like to do most of this dry. I know some people like to do it with water. I've just found that the dust, kind of like when you're looking for MB2 actually, the dust kind of shows me where I need to go and what I need to fix. So it makes a difference there. So now that we got the bulk of that done, I'm just going to smooth off this coronal aspect aspect, I found that this wheel burr is the best burr for this sort of thing because it does create just like a really nice flat surface. I think it works better than using a prep burr sideways or anything like that. And so this is definitely, I wish I would have known this in dental school because I had a lot of problems with the incisal edge when I tried to do it just with a prep burr, but this wheel burr is just fantastic to get that shape there. And what I'm doing is trying to kind of see where exactly that edge is going to be, where the incisal edge was, because thankfully on number 9, there's enough tooth structure I could see where that is, and kind of get everything to within a few millimeters of that. And then we're going to do the bulk of the lingual removal as well right now with the barrel burr. Once again, the more you can do with the rubber dam, the better. At this point, though, we're looking good, so let's go ahead and finish this off. You can see those teeth are definitely long. That's what I was talking about. You want to give yourself more tooth structure to work with rather than less. And what I'm doing there with my hand is I'm actually feeling that your fingers are really good at sensing when there's slight differences between the two. And because the tooth was put back pretty darn close to where it needed to be, but not perfect, I'm going to reshape it so that we have kind of like perfection as far as where everything looks, because we want these to be as close to symmetrical as possible. And that's what I'm doing here, is just finalizing that off. Her face is nice and soft as well. Generally, you're going to find that females have more of a softer, rounder face, and men tend to have more square angles. So depending on the gender and how they look, I'm often going to change the shape of them. So in her case, rounding those edges, just getting things looking nice and soft and kind of what her teeth would naturally look like. This is another good time to ask the parents if they have a photo of what the teeth looked like before the accident. Thank God for iPhones, because we have thousands and thousands of pictures. And I think actually we fun fact, if you only have for shared albums, you can only have 5,000 pictures. And for my 4-year-old, we ran through that in about 3.5 years. So just a random fact for you if you ever do a shared album. But by having the picture of what it looked like beforehand, I'm able to kind of more create what she had naturally. And they were both happy with how her teeth looked beforehand. So that's also a question you got to ask, is make sure they like what the teeth looked like before. So what I'm doing there, once again, with my finger is feeling to make sure that everything feels symmetrical. Whenever you're doing aesthetic work like this, it's really important that you start with 8 and 9, because they're going to be the ones that make the difference here. That's what actually... that's what you see. You want these to be symmetrical. You can play around with the laterals, do a little bit of funkiness, and get creative there. But for 8 and 9, they do need to look as symmetrical as possible. So that's what we're doing during this part here. I noticed that there was a little more overhang on the lingual side or palatal side, so I want to polish that off. Just remove the bulk of it here. She had. Her front teeth weren't touching at all. So because of the lack of support from the lower incisors, that's why this trauma was so bad. She is going to start ortho here, which is great, but they obviously got to get those canines into the right spot first. Actually, I don't know. I'm not very good at ortho. Maybe they do it first? Do they do that first? I don't know. Someone drop, if you like ortho, someone drop a comment below and tell me, do you do the exposures first, or do you start moving the teeth first? I guess you'd have to have space for it. Anyway, we're all learning together. This is fun. So as far as her teeth there, like I said, they aren't even touching. So I'm just going to kind of create what I think would naturally be there as far as the cingulum and the angles. And you can see I'm doing a lot of very just small, minute details here. I love working with line angles and kind of getting the teeth look as natural as possible. So I generally will start with the incisal ones. And then you can see me here moving on to the lingual or the apical ones and making everything as smooth as possible. At this point, though, we're very happy with the shape of the teeth, and we're going to start the polish. So I love this flame burr. It's just a really fine diamond burr that does a nice job of removing those scratches from the larger coarse burr and just kind of getting everything looking great. I found if you try to start off just by doing the flame burr, like it takes forever. So I would recommend bulk removal with something like a coarse or super coarse if you feel comfortable with that, and then move on to something finer and just get it as polished as possible. The gingiva will be fine in that area. I'm more concerned about making sure we don't leave an overhang, so those gums are going to be inflamed with that. And you can see just getting that polish and removing any of those bulk thick scratches, that's where we really benefit from having dry So, quick check the bite. As you can see, she's not touching at all. So I wasn't surprised about that. Now I am going to have her go into protrusive just to make sure that we're not hitting too hard there. And she wasn't even able to get into protrusive. She's so locked in. So there may need to be some final polishing, adjustments when the ortho's done. But where we are right now, I'm not worried about these teeth. So going through here with the Rockstar polish, we start off, it's almost like a prophy paste pretty much. And that helps remove any scratches. This is a good time to, after you rinse it off, before you do the final polish, you can tell real fast if you're going to have to go back. If there's some deeper scratches, this is where you would know. So this stuff works really, really nicely. And then we use this finisher polish. I did actually learn recently, my friend Logan, took the course, you're supposed to use 4 pounds of pressure with water on this. 4 pounds is a lot. That's where you take your finger, push it down until you start to see blanching. That's how much pressure you're actually supposed to use with this thing. So it's a lot more pressure than I expected, but it really does get a very pretty result. So here we are, really can't even tell where the composite is. And to show you, that's where we started. So I know it looks like there's a line on number 9. That was actually there to begin with. Here's what we looked like before. So that's kind of where we were as we were starting to prep everything. You can see those indentations, and very happy with this result. Mom and daughter were both very happy as well. Root canal looks, pretty straightforward there. Anyway, I thought this would be a fun one to show. I like doing aesthetics work. It's one of the more fun things I get to do. As always, thank you guys so much for watching. If you have any questions, please drop them below. Like, subscribe, do all that fun stuff, and I will talk to you all next time.